So Josh is running the Q&A, so if you have any questions, you can just post it in that Q&A area, this button here, and Josh will be monitoring those Q&As. Okay, so you guys all think you're ready to start? Are we ready to start, Josh?
Yep, you want to take it over?
Okay, so Josh is gonna kind of introduce us into the presentation today. Thanks for those of you who hopped on to join us, and take it away, Josh.
Perfect. So, everything's kind of a little upside down with COVID. The gyms aren't open quite yet. I work here at the rec center, and everyone asks that every day, when's the rec center going to open? At this point, we have no idea. Some gyms are opening up like CrossFit, but basically we're not all back to what we used to do. So we kind of just wanted to have a little presentation with some of the PTs at all the clinics that we have, just kind of going over things we can do at home to kind of get us ready for, the next session. Even though A-Base isn't open today, most people are moving on to biking, to hiking, rafting, different activities like that. So we just kind of want to get everybody ready on the same page so that when you go back to your sport that, taking all this time off, you don't come back injured and, don't have to come see us. So today it'll be me, Josh Jones, and then I'm with Sarah Campbell and also Emma Wallace. So we all work at the Breckenridge, Frisco, and Silverthorne office. So we got a representative from each one. Let's go ahead to the next slide.
Ready.
Perfect. And then, if you're new to Zoom, if you want to, please place your computer on mute. There's a little mute button in the bottom corner. And then, feel free, like we talked about, if you have any questions, I think it's easier just to message either myself or just all the panelists, and then we'll answer them throughout the presentation. And this will be a little shorter. If you've joined us for some of the doctors ones, those have been probably a little over an hour. I would imagine today's only going to be around a half an hour or so. So it should be nice and short and sweet. And then also, if you guys have any recommendations on if you're like, this is a good starter one, but here's what we really would like from you guys as physical therapists, feel free to, give us suggestions. This is obviously all new to us. So, we're open to what you guys want. That's why we're doing this is for everyone here. So feel free to let us know. Go ahead, next slide. And then we are open. All the clinics are open. We've been open for a while now. And we're trying to be very precautious with COVID around. So everyone that's in the clinic is wearing a mask, both patient and therapist. Everyone's temperature is being taken, both patient and therapist. And then we're also, asking you questions too of, how you've been feeling lately. Have you lost taste and smell? Just different things to kind of make sure we're as safe as possible. Things are starting to open back up in the county, and we're just trying to take all the precautions we can. We're doing extra cleaning and disinfecting. And we're just trying to do the best we can. And then also patients have been real responsible. So we've had one call and say, hey, I'm not feeling under the weather. I'm going to cancel. I don't want to come in and make people sick. Turned out it wasn't COVID, but it was just nice that, people are taking responsibility. All right, go on to the next one. And then just want to talk a little bit about direct access. So in the state of Colorado, you are allowed to go to a physical therapy without a doctor's referral, especially if you've been here before and you know a therapist that you like. Say you sprained an ankle like this guy playing basketball, you can come in and we can kind of take a look at it. And the reason that, all of us now are getting doctorates in physical therapy is so that we can kind of differential diagnose and say, hey, this isn't just a regular orthopedic injury. You need to go, to a medical doctor. And so we hope that people aren't slipping through the cracks of being like, oh, they should have went to a doctor, but that's where we are too. We're a good screener that we can make sure like, okay, yes, this is something we can treat, or no, this is something that needs to go somewhere else. And then you can call the clinics to see if your insurance covers it. So naturally with most insurance, it's just because it's allowed to go direct access doesn't mean insurance is going to cover it. So you might want to call ahead just to make sure to see if your insurance covers direct access. And if it doesn't, then usually you just have to go to your doctor, get a prescription, and come here kind of like we've done before.
Yeah, two insurances that do not cover it are Medicare and Medicaid. So watch out for those two. Other than that, next slide.
Yep, we'll go to the next one. So just going to give a quick introduction to your host here. So Dr. Sarah Campbell, she's at the Silverthorne Clinic. And I'll just kind of give a background, just to get to know us a little bit. She is actually a native of Michigan. She got her undergrad in kinesiology from the University of Michigan. And she found her ways into the mountains at Regis University, where she got her PT degree. Graduated in 2017, and she came to Avalanche right after school. So she's been here ever since. She enjoys working with orthopedic injuries of all sorts. And also she's acquired a vestibular certification in the winter to help those with vertigo and dizziness problems. So she, definitely if you got vertigo and dizziness, even if you live in like Breck, it's probably a good thing to go see Sarah for that. And then we have Dr. Emma Wallace, who works at the Frisco Clinic. She's an Illinois native and went to the University of Colorado. She got her doctorate in physical therapy in 2017 as well, and spent some time with Avalanche PT working in the acute ski and snowboard injuries when we used to work at the clinic on the base of Peak 9. Then she got into travel PT, where she worked in a variety of settings. And now she actually specializes in women's and pelvic health physical therapy. So, postpartum, anything like that, Emma's who you'd like to go to for those type of injuries. And she returned to Avalanche in 2019 and also specialized in orthopedic injuries. And then beyond physical therapy, she minored in dance. She used to teach yoga. Emma has a love for movement and the eye for movement efficiency. And she believes in optimizing of movement to help her patients return to their active lifestyle. And she's happy to be back in the mountains where she can go hiking, biking, kayaking, snowboarding, backpacking, yoga, and dancing, kind of like why we're all out here. And then myself, I'm Josh. I work at the Breck Rec Center. I am from Virginia originally. I went to Bridgewater College, majored in biology, then went to Old Dominion University, graduated with my PT degree in 2011. Did some travel PT, kind of been all over the country. Ended up here for a 6-month contract about 5 years ago, and been here ever since. And then been lucky enough to get to work with do tour X Games, see a lot of orthopedic injuries. Definitely seeing a lot of total replacements right now, knees and hips. And then, just loving the mountains. So that's why we're all here. And so I feel like if you have therapists that love the mountains and love doing all the things that you love doing, we definitely understand how fast you want to get back, but safely. But now we're going to turn it over to Sarah, and she's going to kind of take over from here.
Sounds good. Are we good on questions and everything?
Yep, no one's asked any yet.
Cool. So, keep moving this guy around. Okay, so here's what we're here to really talk about is those kind of change in activities. So from your skiing, snowboarding, snowmobiling, snowshoeing, skinning, cross-country skiing, shoveling, all those winter sports and I guess chores that we have to do. And now we're starting to transition into those summer activities. Made a giant list here, but definitely not comprehensive on all of these fronts. So walking, hiking, running, biking, gardening, yard work, tennis and pickleball, all those water activities out on the lake or on the river, golfing, and then all the rec leagues that hopefully will be starting back up this summer, those soccer, softball, and kind of those outdoor activities. So definitely a big change in muscles that we're using and time that we're spending outdoors. I feel like people tend to spend a little bit more time outside when the weather's nice. And I mean, shoveling and gardening are both yard work, but I feel like people enjoy the gardening a little bit more. So they might spend a little extra time out there working on plants and moving boulders or whatever good stuff that you guys do for yard work. So some current concerns we have with people transitioning into these different activities are definitely falls. So if you're falling more frequently, or you're stumbling, or you just feel unsteady, I mean, ice is slippery, but we have a lot more surfaces come the summer. We've got grass, rocks. With hiking, you get roots and upturned plants and trees and lots of uneven surfaces that we find when we're out there. And then we also are concerned about if you're having pain with activity, So if you're having like knee pain, just hiking or walking, or if you're out biking and you're having like neck and shoulder pain, we get concerned about that. If it's not going away rather quickly, if kind of the rest of the day you're rubbing your shoulder or rubbing your knee, kind of feeling like you need to put ice maybe or stretch a little bit more. We don't really like hearing that happening for prolonged after activity, because then that kind of leads me to this third category, is getting into overuse injuries. So we don't want you out there having pain with activities that's not going way too well. That turns into these kind of chronic injuries. So anything over 3 months, we kind of determine as a chronic injury, and those are a lot harder to treat. So if you're getting pain with activity, come see us before it turns into this overuse chronic condition, because we can fix these acute conditions a lot faster than the chronic ones, because you get different tissue adaptations to the chronic injuries that just takes a little longer for your body to return back to normal and be able to tolerate your normal loads. Are we still just seeing Josh, or are we seeing me at all?
I see you.
You see me? Okay, I just see Josh. Sorry, new to the whole Zoom hosting a meeting, so bear with me. Okay, so kind of reaching out to those common complaints that we get with pain with activity. So big thing is knee pain with hiking and walking. You're going up and down uneven surfaces, or even out on the rec path. We don't want your knees bothering you when you're going downhill, is the major one we hear. And then any knee injuries with tennis and pickleball, like Josh said, we're direct access. So if you're like, oh, I tweaked my knee weird when I went to dive for this ball, we can definitely check it out and let you know if you need to go see ortho, or if we can kind of manage it conservatively, kind of based on different presentations and findings that we see when you're in the clinic. And then another common lower extremity injury is kind of ankle calf pain. So kind of headed towards the idea of Achilles tendonitis, kind of insertional pain down around your heel bone, or even into your foot with like plantar fasciitis problems. Those are all conditions we treat, as well as any low back pain that you're getting with gardening, yard work, bending over on your bike. We hear people get neck and back problems from being on your bike too long, and then falls and instability, kind of like I was talking about. So we can work on balance problems and making sure you're stable out there, because we don't want you falling and hurting yourself even more. And then with the upper extremity, like I said, back pain, neck pain, reaching over, leaning on those bikes. So lots of time spent in the saddle can cause some of those prolonged posture pains. And we've got lots of muscle activities that we can train and get your endurance up. And then it's kind of talking about throwing. So, softball, throwing frisbees, playing with the grandkids, whatever good stuff you're doing. Shoulder pain, you shouldn't be having problem throwing distance. Gotta keep the kids and the dogs healthy by making them run around for toys. And then neck pain with gardening too. So a common complaint is moving a lot of gardening tools or pots around, and all of a sudden my neck is kind of sore and shoulders are achy. We've got lots of tricks to help reduce those kind of complaints as well. Sorry. You might be wondering, why do you have to prepare for change activities? I was skiing and biking, well, if you do fat tire biking, but I was skiing and cross-country skiing and walking all winter long. So like I was saying earlier, a lot of times people are outside more, longer periods of time in the summer because the weather's nicer, you've got more things that you can do outside. So kind of talking about that endurance aspect, you're definitely out there longer. We don't want to getting fatigued and then hurting muscles. A lot of times people will go past that endurance point that they're trained for, and that's when injuries happen. You're doing more repetitive motions. Again, you're hiking longer distances. When you're skiing, you're usually going down a run for 2, 3, 4, 5 minutes, however long it takes you to get down a run, and then riding a chairlift up for 5 to 10 minutes, depending on which chair you're on. So you're getting that nice rest, but oftentimes when you're hiking or biking, you're kind of out there for the long haul. You might rest when you get to the top of Vail Pass or around the lake or out to Green Mountain, but you're not necessarily resting after 5-10 minutes of activity. And then we've also got different surfaces. Like I said, ice is slippery, but when you're working with uneven surfaces, ankle injuries, hip injuries, you got stabilize for your back. So we've got lots of different muscles working on those different surfaces, more so than they do when you're just walking on ice and snow and salted surfaces. And then we've also got a big change in load to all those muscles. So oftentimes you're wearing backpacks or moving heavier equipment, lifting your bike in and out of your car, lifting your kayak up on top of your roof rack, all those good things. So you're tending to use your upper body more than you are with winter activities, or a lot more legs, skiing, cross country skiing, hiking, walking in the winter. Now you're turning to lifting your kayak, using your kayak paddle in the water, your stand-up paddleboard, carrying more weight on your shoulders with your backpacks. So we've definitely got all these muscles that weren't working all winter now working in the summer. So we want to watch out that you're not just jumping right into these hikes and bikes and not really giving your muscles the time they need to break in. Even though you're still cardiovascularly fit, some of your muscles have been on vacation all winter. So we want to make sure you're breaking into all these activities slowly. And Emma's going to talk more about the activities, or breaking into these activities slowly, how to adapt some of your movements, and then finally some exercises. So I will hand it off to Emma here, and she can kind of lead us through this section.
Hi everyone, thanks so much, Sarah and Josh. Can we go to the next slide?
Yeah.
Awesome. So like Sarah was just talking about, lifting your kayak, putting it on the car, lifting your bike, putting it on the bike rack. When you're gardening, lifting maybe a heavy rock. We don't realize, but sometimes our lifting mechanics aren't the best, and we're doing those things repetitively on a daily basis. So it's important to use our muscles to basically help support our body, so we're not getting a low back strain and we're not having pain that isn't necessary. So when it comes to lifting mechanics, you want to make sure you're really using your legs to lift. You also want to make sure you're engaging your core. I like to think about engaging the core, thinking about pulling the belly button up and in, like you're putting on a tight pair of jeans, maybe thinking about the pelvis coming up to meet the rib cage, some sort of cue to have some stability through your core to protect your back. You also want to think about bringing your shoulder blades down and back when you're lifting, so you're not hunched over, you're really up tall, squeezing your shoulder blades in and down, to make sure you're not going to hurt your shoulder when you're lifting as well. And then also getting into some warm-up exercises as well. If you do plan on going on a bike ride, doing a lot of gardening, whatever it may be, engaging in any prolonged activity, doing a little warm-up just to get your muscles and your body ready for that activity. Some nice warm-up activities, like shown in the picture, doing a little press-up can be helpful for the back, doing a standing back bend as well. I also think bending forward once or twice, getting the hamstrings warmed up is important before you're lifting. And then as you're engaging in your activities, make sure you're not going out for a 5-hour bike ride the first time. I know a lot of people out here like to just go right for it, but we need to respect our bodies and make sure we're easing our way into activities. So starting with a 30-minute bike ride versus a 5-hour bike ride is a better way to kind of ease yourself into it. If you are getting any aches and pains when you're, let's say, gardening, biking, it's probably your body telling you, hey, something's off, you're not using your muscles correctly. Listen to your body. It's telling you if you're going to have maybe a overuse injury in the future. Let's go to the next slide, Sarah. And then core and basically stabilization exercises for the spine. The first exercise that is shown is a bridge. This is for engaging basically the core, but also your glutes or buttocks. And then also shown in the picture is a double leg bridge, or using both legs at once. When you're doing this bridge, you want to think about pressing your heels into the table, and then thinking about engaging the muscles that are right around where your sit bones are, and then engaging around the core or the abdominal muscles. To make this exercise a little harder, you can come into a single leg bridge. That requires a lot more core and just lumbopelvic stability in general. So making sure you're starting at normal bridges, and then if you feel ready, you could go into a single leg bridge. For skiing and as well as any kind of outdoor activity, making sure you're doing single leg exercises are important. It just uses some different muscle groups. The next exercise we have on here are pelvic tilts, or just engaging your lower abdominal muscles. So that's that second picture shown. The male in the picture is flattening his back on the table. And then thinking about, once again, drawing the belly button up and in, like you're putting on a tight pair of jeans. You can also think about the rib cage and pelvis drawing closer together. You can think about almost drawing up and around to almost create that stability, almost like you have an abdominal binder on to support the spine. When doing this, incorporating your breath is also really important. Like Josh was saying, I do some women's health. When you're inhaling, that's your relaxation phase. As you're exhaling, that's when you're engaging the core within that exercise. When you're exerting yourself a little bit more, you want to do that nice exhale so you're having equal intra-abdominal pressure, and you're not having too much pressure and not enough pressure to transfer that load or lift something heavy. The next exercise is cat-cow pose, just working on spinal mobility, coming into a nice flex posture and a nice arch posture, making sure you have equal movement between the two motions. This just helps get the spine warmed up for the day. And that last exercise, chin tucks, helps with kind of your neck posture. If we are working from home a lot with COVID and we're sitting at a computer quite a bit, we have a tendency to come into kind of a forward head posture. That posture is not great. It puts a lot of stress on the neck and the shoulders. So chin tucks are basically helping create that neutral spine, neutral alignment. So you're just thinking about the chin drawing back, tucking your head, so from the side, instead of being out here, tucking to create that neutral spine. She's doing it laying down. You can also do it against a wall. And even when just taking breaks, if you're at your computer a lot, to try to do a few chin tucks, checking in with your body, seeing if you're having any of that shoulder and neck pain, trying a few of these exercises, seeing if it's helpful to just even break up your day. And then obviously if you're having pain with these exercises, maybe you need a few more cues. That could be a good indicator to come into the clinic. And if you're still having pain after doing warm-ups, after doing some of these exercises, maybe there's something more that we can do for you. These are obviously just suggestions. One size does not fit all with therapy, so we can definitely give you a more individual program. Let's go to the next slide. And then these lower body exercises, more for that leg strength, obviously. So the first one is clamshells. This is for your gluteus medius. So with your glute med, basically an important part is single leg stabilization. And it helps prevent injuries, helps prevent that knee collapse we see sometimes when we're skiing or maybe when we're hiking. And even biking. With clamshells, some things to keep in mind, making sure your pelvis isn't rolling backwards. So if you look at the picture here, you can see that his pelvis isn't moving. The only thing that's moving during this exercise is the top knee. You can also think about engaging from the sit bone and even through the pelvic floor while you're lifting that leg up. It just creates more lumbopelvic stability. The next exercise, side lying hip abduction, which is that side lying leg lift. Also something to be cautious with, making sure you're not rolling with the pelvis and making sure your leg doesn't creep forward. That engages the IT band. And if you do that repetitively with the IT band being the primary driver of that exercise, you can actually develop knee pain. So when you're doing that exercise, making sure you're completely lifting to the side, and if not, think about lifting back. You can also do this while laying against a wall and kind of lift your leg up against the wall so you know if you're actually lifting straight up to the side. Next exercise, single leg stance. Making sure when we're doing a single leg stance, great for balance for one. You can do this like brushing your teeth or, holding onto the counter. But when we're doing single leg stance, making sure, if you think about your pelvis, your one side of your pelvis isn't dropping down, that you're really using your muscles to support that one leg. So in the picture, he's standing on his left leg. You want to think about engaging your glutes on the left, engaging your quadricep, and engaging your core so you're not getting any pelvic drop. That's pretty common during certain activities, is seeing a big drop. You can even notice in your walking pattern, you can get almost like a lateral lean if those muscles aren't working for you. And then the next one, side steps. These also get those glute muscles or side hip muscles to start firing. Once again, when you're doing these side steps, making sure your toes are in neutral and they are not turning out a lot. That just gets a different muscle group that we don't really need to focus on. So having the toes facing forward, side stepping, making sure your knees aren't collapsing inward either. As you can see in the picture, he has equal distance between his knees. They aren't collapsing in the middle at all, which is a great representation of how the exercise is done. And then I think we can go to the next slide. Oops. Sorry. So we're looking at more of those upper body exercises. So the first one, rows. When you're doing a row, thinking about your shoulder blades coming together, and then even thinking about them coming down and back. I like to think as if the shoulder blades are crossing almost to the opposite back pocket muscle. A lot of times people do rows and they think, oh, I'm doing it right, but they're really doing a shoulder shrug. So making sure you're thinking about more of that down and back motion. Next exercise, scapular retraction, basically the same concept as a row. It's just a little easier. So once again, if you're at your desk a lot, you're doing kind of this remote work right now, scapular retraction or shoulder blade squeezes are great just to make sure you're not coming into that hunch posture. The third exercise, external rotation of the shoulder, which is seen in that, third picture. So this motion here is shoulder external rotation. That helps stabilize the rotator cuff and just the scapula in general. It helps prevent injuries with lifting. When you're doing this, you can see that the towel roll is in between the body and the arm. That just makes sure your shoulder's in a neutral position. And it helps, decrease any pain that could be had during this exercise. You also want to make sure you're not over, bringing your arm to the side. It doesn't have to be a huge motion. You can just do a small lift that's about that big. seen in the picture, if you really overemphasize it, you're probably going to rotate into your chest and back and not really do the exercise correctly. And then that last picture, shoulder extension or pulling down on the band, once again helps with that scapular stabilization. When you're pulling down and back, making sure your shoulders aren't driving up again, and that you're squeezing those shoulder blades down and back as well. And then we can go to the next slide. And so that's kind of the general exercises that we have for you as some recommendations. Obviously, like I said, one size doesn't fit all. So this isn't necessarily the best program for anyone, but this is for everyone, I mean, but this is a great way to increase your basically stability through the body and reduce possible pain that could arise from starting new activities. Obviously, without gyms being open, like Josh was saying, we're a little limited in how we can do some of these exercises and how we can get back into a normalized workout routine. Like I'm telling every one of my patients right now, be creative, use your laundry detergent with squats, you know, maybe have 2 detergents or 2 jugs of milk, do some squats with your laundry detergent. Maybe you're doing an overhead press with a can of soup. Whatever it may be, there's different ways that we can be creative. To give you an idea of what some weights are, you can see on the slide, a can of soup is about 1 pound. A carton of milk is about 2 pounds. A small bag of rice, 3 pounds. And a bag of flour, about 5 pounds. Your laundry detergent is more of that 10 pounds. That's why I think squats with laundry detergent, why not? It adds a little bit more weight and makes that exercise just a little bit more challenging. If you haven't done any of the exercises we talked about today, obviously don't add weight, see how they feel without any weight, and start with a low repetition and then add up from there. We can go to the next slide. And then, so that basically concludes our talk about exercises. Just to give you guys a better idea, we have our 3 clinics. We have our clinic in Silverthorne, which is where Sarah works. We have our clinic in Frisco, which is where I work. And then we have our clinic in Breckenridge, where Josh works. And we have multiple other therapists besides just the 3 of us. We were just available tonight to help do this little informational talk. And obviously, if you have any additional questions about the specifics of the location, just hop on our website at avalanchetherapy.com and or give us a call if you have any specific questions or want to schedule an appointment with us. Do you guys have anything else you want to add?
I just wanted to mention that typically this time of year we would be doing a sports agility class, yep, at the Breckenridge Rec Center with Josh. Usually runs that for us, but obviously due to the times, we're not allowed to do that. But hopefully we'll be able to start it back up in the fall. But we usually do that every spring and every fall to help people transition to sports. So we incorporate general strengthening, can answer any questions for you, and then we also incorporate some more higher level plyometrics for those who are ready for it. But a lot of times that's good for people who injured themselves last year and they're just looking for a little bit more push when they're done with traditional therapy. They can go hang out with Josh and he'll push you for an hour. So like I said, usually we do that this time of year. So we're hoping to just kind of get out there and answer any questions since we're not obviously doing it right now. And then hopefully we'll be able to do it in the fall. The rec center hopefully will be open, fingers crossed, because I know we're all getting sick of working out at home. And then, yeah, Josh, did you have any other closing comments?
Yeah, well, just to kind of go off of that as well. One thing too, like some insurances only allow you to have like 20 visits, and something like an ACL recovery. I mean, professional athletes aren't going back to sport, the very earliest 7-8 months. So usually around 9 months. And so, if you have 20 visits spread out along that time, you might not get to really fully indulge in like the plyometrics, weight training, things like that. So it's kind of a nice, way to progress yourself and kind of get yourself ready for the next season. So with that class that we do. But yeah, other than that, no, things are good. Tom does have a question. Maybe we'll go this one to Emma. Is there any specific exercises for low back pain?
Yeah, Tom. So if we kind of look back at that slide, Sarah, I don't know if we can bring it back to that that pelvic tilt, that slide. So these are all good exercises for low back pain. The chin tucks, not necessarily, but the other three are all great exercises. The more you can engage the core, the less pain you typically have in the back. Obviously, you can continue to do even more stretches, any type of spinal rotation, depending on how that feels, can also be another exercise. And then there's a whole plethora of core exercises that we can kind of tailor to what specifics are going on. So I would say these are the main ones for low back pain.
And a lot of it's just kind of judging, sometimes it's hard to see what's a good pain, what's a bad pain. Everyone's always like, oh, when you go to PT, it's going to hurt. That's sometimes the case. But, if you're feeling that sharp pinching pain, then that's something that you kind of want to avoid. That's kind of what your body's telling you to avoid. And if it's a dull ache, that's something you can push a little bit. But if that dull ache starts to escalate, then you kind of want to back off too. And, without having someone to kind of, watch over you or whatever, those are kind of some nice guidelines to say like, oh, is this something that's good for me or is this something bad for me? Because, everyone wants to get better and everyone thinks more is better. But sometimes your body's saying, no, just kind of back off. And so, really once you can start to learn like what your body's telling you, that can really help you from, hopefully preventing those more serious injuries. Any other questions at this time? And then also, let us know if you have ideas, and it doesn't have to be right now. You can call the clinic, you can email any of us, and just say, hey, if you guys are going to do another one, can we focus more on whatever? Because like we said, we want to do this for you guys mainly. So just feel free to.
Yeah, so we'll be posting this presentation with our commentary on it on our Facebook, and I think our website listed there as well. So you can share it with friends and family who may not have been able to make it, but we're meaning to. And then I just wanted to throw out one other little reminder with A-Basin open. I don't know how many, I know they're only allowing a couple people here and there, but spring skiing is definitely one of our busiest times of the year. People tend to hurt themselves a little bit more. They get a little lackadaisical, aren't as aware, and especially with us taking 2 months off skiing here, just want to, same principles apply. Don't go out there and shred all day at A-Basin. Make sure you're taking your time easing back into it, even though you only get that one day out of the lottery or whatever. Just make sure you're washing your body so you can play all summer with the nice weather we have now. And if anything's not feeling right, please reach out to one of us or one of our clinics, and we can get you with someone who can develop that individual treatment plan and keep you going all summer long. Sound good, everyone?
No other questions?
No other questions. Quiet group. Oh, there's a question, right? No?
No, thanks, Jen. Appreciate it.
Yeah, thanks.
But yeah, no, thanks everyone for coming. And like Sarah said, it'll be on the website, so you can watch it over and over again.
Yeah, if you don't miss us now. Sounds good.
All right, thanks guys for putting it on.